Nursing research as an important way of improving service delivery. Introduction. Healthcare facilities cannot function without nurses, and this means that these people play important roles in providing disease prevention and treatment services to patients and society. In addition, they perform other supportive roles that are not necessarily related to their professions, and this helps to keep society healthy. This essay examines the roles of nursing research and how it can improve this profession. Definition. Nursing is a profession that specializes in the provision of healthcare services to ensure patients get quality and timely services. Moreover, it educates and informs society about hygiene. Therefore, the services offered by nurses do not end at healthcare facilities but extend to schools, churches, and homes. Research is a systematic process of finding answers to questions, explaining an occurrence, and establishing ways of managing challenges facing society. The role of nurses in research. Nurses play important roles in nursing research because they offer their services by examining patients and managing their situations. Nursing research involves looking for ways of improving the provision of healthcare services and maintaining professional conduct. Nurses are at the center of providing healthcare services because they are in direct and regular contact with patients. Therefore, they observe and talk with them, and this allows physicians to know how to manage different situations. This research does not necessarily involve going out into the fields to conduct investigations. Nurses examine, treat, and advise patients about their health, and by doing this they learn various issues from them. Secondly, nurses record their observations from different patients and can draw conclusions about them just by looking at their records. This is an important way of collecting information from different patients about their health conditions and examining whether they have similarities or not. This information offers important details about disease patterns, occurrence, and distribution. Health departments use this information to plan to manage diseases before they spread and affect people. Lastly, nurses advise patients about how to improve their health conditions, and this is an important way of preventing the spread of communicable diseases. In addition, they advise their family members and other people in society about ways of controlling and managing diseases. This is an important way of ensuring that health policies produce the expected results and disease outbreaks are contained before they affect a huge population. Advantages of nursing research. This research is conducted by nurses when they are doing their ordinary duties, and this means that they get first-hand information from patients and their families. The interaction between patients and nurses enables them to learn important issues about diseases and how they affect people. This information is used to develop effective measures for managing diseases and keeping people safe from infections. Secondly, this research promotes teamwork among nurses and other stakeholders. Nurses need to work together with physicians, patients, and their families to ensure disease prevention is a communal responsibility. It is easy to fight diseases and improve human health when people unite and understand one another. Lastly, this research is not expensive because nurses use patients as their subjects. Therefore, they conduct their research at healthcare facilities and at the same time offer treatment and counseling services to patients. Impacts of nursing research. Nursing research is important to nurses and patients because it enables them to effectively play their roles. First, it gives nurses skills and knowledge on how to manage various situations, and this helps them to promote healthcare measures that are important in disease prevention. They find new treatments for different diseases, and this widens their knowledge about health issues. In addition, this research enables nurses to monitor and predict the outcomes of various situations, and this helps them and their patients to be prepared for the future. Secondly, it helps governments to establish policies that facilitate the provision of better healthcare services by nurses. This is an important way of ensuring the needs of nurses are met to promote their efficiency and boost their morale. Therefore, they conduct research to establish ways of improving their service delivery and help governments act by increasing funding and upgrading medical facilities. Lastly, this research enables nurses to be patients' advocates and assure them that they are safe provided they follow instructions. Patients must be treated with a lot of care because they need special attention, and this research enables nurses to know how to manage this situation. Therefore, they learn communication, observation, and interaction skills that are important in the provision of healthcare services. On the other hand, this research enables patients to know that nurses work hard to improve their conditions. This gives them hope that their diseases will be treated, therefore, they cooperate with them and ensure they follow their instructions. Secondly, most patients think that they know what is good for them, therefore, they refuse to take advice from nurses. However, this research ensures that patients and nurses know each other, and this eliminates doubts and fears that are serious impediments to treatment. This research enables nurses to offer evidence and patient-based treatment, and this eliminates the possibility of wrong diagnosis or prescription. Therefore, patients will be satisfied with the quality of services they receive from nurses. Significance of nursing research. Nursing research generates knowledge that is important in disease prevention. This helps nurses to manage complicated health conditions before they get out of hand. In addition, it helps nurses to compel governments to form policies that will safeguard and improve the welfare of patients and nurses. This research enables people outside the nursing profession to understand the roles of nurses and how to make their work easier. Therefore, it promotes understanding among patients, their families, and nurses, and this improves the provision of disease treatment and prevention services. Lastly, it enables nursing graduates to understand the challenges facing this profession and prepare to manage them. Research enables learners to know more about issues that were strange to them. In addition, it ensures they get accurate and credible information about various health issues. Therefore, when they start practicing, they already know what to expect and how to manage it. Conclusion. Nursing research is an important way of improving service delivery and generating knowledge about human health. Therefore, nurses and patients should cooperate and support each other to ensure this process succeeds. There is a need to use the information obtained from research processes to transform nursing and change people's perceptions of this profession. Governments and well-wishers should support nursing research to ensure nurses offer services that are useful in the modern world.